What's up, guys? Welcome to another powerful conversation, a needed conversation with me, Suli Breaks, where we challenge societal norms and have conversations that empower specifically the Black community in the UK. In this episode, I'll be speaking to Dr. Catherine Ben-Hura. She's a multi-award-winning general practitioner, a GP, a doctor, but not just that, she's also a wife, a mother, entrepreneur, advocate, community leader, and speaker. And we want to discuss the very necessary and crucial topic around cancer awareness and the barriers that's preventing our community from seeking the very needed medical advice. Before we go into the interview, I think the biggest barriers to cancer awareness in our community is the conversation we don't have around it. It's something we don't talk about. We try to hide it or keep it away from our networks. I know two people who personally died at relatively young ages from cancer. It feels like we always found out at the later stage. You know, me personally, I found out at the later stage where there's not much you can do, or like you're not sure how to kind of navigate the situation. As a matter of fact, one of them I didn't actually find out until after they died. If we just had these conversations a bit more often, it might make a difference to people who are going through the situation, or people who know people that are going through the situation, or in some way just improve the research and conversations and discussions and development we have around cancer and the stigma associated with talking about it. So, Dr. Ben-Hura, can you tell us a bit more about this campaign?
Absolutely, Sully. So the NHS is recognising that there are challenges that are specific for the Black community in the UK regarding cancer, and being aware of it and raising that awareness and knowing what to do earlier on to get the diagnosis. And we know that in the Black community, there are many different factors, whether it's cultural, whether it's societal, and they create these barriers that are stopping people from seeking medical help. And this campaign aims to break those barriers, and it raises awareness, it educates people on the signs and symptoms that we all need to recognize. And we are encouraging people to be more aware of their bodies, know what's your normal, know what that feels like, looks like. And if anyone was to notice any differences or potential cancer symptoms, it is very important to contact your GP without delaying. And we understand that anyone can get cancer, but specifically for our Black community, there are certain cancers that are more likely to happen, like prostate cancer. So it is very important that we notify the GP early, we find it early, treat it early, so we can actually save lives within our community.
Interesting. And speaking of our community, like cancer specifically, you know, because of the nature of it and the consequences of it, it's something that we tend to like shy away from having the conversations, you know, especially being African. It's kind of like there's a sort of stigma or shame attached with vocalizing that one of your family members has cancer or they're ill. And I kind of don't understand it, because sometimes people will be like, don't tell anyone that you've won the lottery, because people will have all these like, you know, where's my check, you know? But why do you think it is that with cancer specifically, which is merely about health and awareness actually helps, why do you think we shy away from discussing that as a wider community?
I think the main thing is lack of understanding. I don't think our community understands what the journey looks like and how important it is to find these symptoms and signs early and how it can save life. I think, yes, you mentioned certain taboos and stigmas, like, for example, if you have cancers because some ancestors done something to you, or you've done it, you've caused it to yourself, not knowing that there's many other factors behind it. And, you know, it's really, really hurting our community. And I want it to be more of a conversation. In many other cultures, it is very normal to talk about cancer, and it should be the same for us, because there are certain cancers, like I mentioned, like prostate cancer. It's more predominant in our culture. The NHS has found that, okay, these are the problems, and it's helping us. We are helping ourselves. We're helping each other to combat those.
And I found there's like a sense of like weakness attached with it, especially when it comes to something like cancer, to be like, it's your fault, or you've brought it upon yourself in some capacity. But I think in general, with most illnesses or most kind of like ailments in our community, there's this mindset of like, there's more important things to focus about. You know, just shrug it off. You'll be okay. It's not that deep. And it's like, if we don't think about it, it's not that much of a big deal. But how can we talk about the strength it actually takes to look after our health? You know, how do we encourage people to listen to their bodies rather than thinking ignoring them is a sign of strength or perseverance?
Well, I'm glad you asked that, because a sign of strength is knowing yourself, knowing what is your normal and paying attention to these symptoms, as they could be a sign of cancer. So, for example, if you have a lump anywhere in your body that is not going away, you don't really know why it's there. If you have blood in your urine, even if it's that one time, you want to let your GP know about that. If you have blood in your stools or it's coming out from your back passage, that's something that could be concerning. Even as a woman, if you have bleeding after your menopause, so after a year since your last bleeding, then you're postmenopausal. So if you have even just a bit of spotting, that's something you want to mention. And if you're bleeding in between periods or even after sex, all those are symptoms that could be cancerous. And if you notice any of these that are lasting for 3 weeks or more, again, these can be signs of cancer. For example, a cough, something so simple, something that you would brush off. But if it's lasting more than 3 weeks, or the existing cough that you had changed, it looks different, sounds different. Or if you develop a sore in your mouth that doesn't heal, or if you have a bit of tummy troubles, whether it's a bit grumpy, a bit bloated, a bit crampy, or your bowels change, whether it's very loose like diarrhea or you're very constipated, most days anyways. So all these symptoms that you would take as everyday issues, they are persisting. It is very important to see your GP, because the earlier we catch the cancer, the more treatable it is.
You know, when you're talking about listening to your bodies, I've found that a lot of people don't listen to their bodies enough because we're always on the go and we're not self-aware. It's only when I really started like exercising and watching diet that I started to see how my body reacts to different things, but generally you're just kind of like very dismissive about everything because you're just like, I just need to get on with my day. What does someone do then when they have one of these symptoms? Because one of the things about not going to the GP is like there's a lot of fear and there's a lot of, sometimes the idea that, the GP is going to give me the runaround, the GP is going to judge me, the GP, like what I said, I went for a prostate exam. I didn't have to go, but I took myself. And, my heart was beating the whole time. I wasn't worried about prostate. I was just worried about, man, I have to sit down and I have to get examined, It was funny because I was speaking to my wife and she was like, yeah, you've never been a woman. Women, we get examined like all the time, like in intimate parts, I was like, this was a big step for me, and that fear of the unknown.
Now, that's a very, very important point you mentioned. That fear of unknown is what is stopping people. That anxiety that you get, that feeling of, what if this actually is cancer, is literally what's stopping people from going to their GP with these symptoms. And they are worried about the test itself. What does that mean? Maybe you wasn't sure what the prostate exam meant. That can be scary. Even for a woman, getting a smear test can be scary. What do the investigations mean? What is the potential diagnosis? And the overall process, really, it can be scary. And we understand that, and we're trying to increase the knowledge so then people can actually go feeling that fear anyways. But as a GP, I'm literally here to reassure you that if we do think that any of your symptoms could be a sign of cancer, we will guide you through the process. And I do take time with my patients to explain. And that's the problem, that, if someone doesn't know, they'll be scared of anything. But we will explain to them, what are the tests? What are the investigations? What are we thinking? And it's important to remember that any of these can also not be cancer at all. But you wouldn't know until you come to us. And the NHS is there to support through every step. So if it is cancer, we have what we call the MDT, the multidisciplinary team. It's a group of people that take care of the patient through the different stages, whether it's physical support they need, emotional support they need, mental support they need. There is a team for all of that. And the NHS is committed to making that journey as clear and as supportive as possible.
I think you made a valid point about us just not knowing the implications of the test sometimes and not wanting to go through that. Like when I went to do the prostate thing, I was like, okay, I have to go and do this because I've seen all this signage. And then he was like, okay, we're going to do the examination. If anything's wrong, if you feel anything, we might have to take an x-ray. And I was like, x-ray? Like, unfortunately, I didn't have to, you know what I mean? But I imagine even that, thinking like, why would I need to go and do something so invasive, you know? How do we overcome this resistance that we have, like the personal resistance we have?
I'm glad you mentioned that resistance, because it is there for many, many reasons in our community. And an example of this was found in a recent NHS survey, where almost half of the respondents, and that's 49% within the Black community, would put off going to see the GP to get their symptoms checked. You know, and something as simple as having a bit of tummy troubles or blood in the urine that one time, because they will think, oh, that's not serious, or it only happened that one time. It can be a sign of cancer, but because they've brushed it off, they've taken their time. And some people, it's true, I understand it, nobody wants to receive bad news, you know, but dismissing these symptoms as minor can actually be quite serious. And they would never know unless they see their doctors. And there's also the worry of taking up the doctor's time. You know, as you mentioned, the reports that you have with your doctor is very important. Are you wasting their time? Are they going to take me seriously? Would they judge me? All those questions, we recognize them and we are combating them. We are letting people know that we are here for you. We are part of the community. The NHS is part of our community. They want to support us and empower us with the right knowledge, the knowledge of the symptoms, what actions to take, and understanding the support that's also available if it is cancer or if it isn't. You know, if you don't know, then you don't know. And that's why I say knowledge is power. And it's true, it can save lives.
The NHS has done wonderful things, like for my own family, for even me, you know. So I feel like there is an element of us that we need to humanize them a bit, because like you said, there are people from our community that are in the NHS and that are very much invested. And I think sometimes we don't see it as that. We just see it as this big institution. Do you have any examples of your own experience where like early detection or someone just being very forthcoming about the situation has made a difference?
Absolutely. I will never forget the experience I had with a very close friend of mine, because we're friends. She was really excited that, you know, my friend is a doctor. So every cough and cold, she used to call me. On this occasion, though, it was slightly different. She said, oh, you know, I found the skin on my breast has changed. And I was really happy, first of all, that she even came to me because of the things that we're talking about and the stats that we see. But she came to me with that, and people are more aware of their breasts now, which I'm really, really happy about. So she was on FaceTime and she showed me that the skin was dimpling, and immediately my antennas went off, because I thought, that's not normal. I obviously don't know what's inside your body. It could be perfectly nothing. But the right thing was, you need to go and see your doctor. You need to go to your GP. And she was apprehensive at first. She was like, oh, no, but you're my doctor. Can I see you? And it's like, I wish I can't, but I can go with you. I can support you. I can advocate for you. And that's what we need to do in our community, support and advocate for each other. She went there. She had the scans. She had the sample taken. And unfortunately, it was cancer. But because she went early, she was able to get the full treatment. The cancer went. It disappeared. And this is the story for many, many people that people don't talk about. Like you said before, people talk about the fourth stage, the last stage of cancers. People don't talk about the first stage. That is very easily treatable. And the treatments available for different stages are different. And people don't know this. And it was in the same NHS survey that I mentioned before that a third of respondents, that's 33% in the Black community, often put off a visit to their GP. Yeah. And that's because they're afraid of the potential diagnosis. And she could have been one of them. But even though catching cancer early makes it more treatable and can save life, and it did make it more treatable for her, and it did save her life.
Well, that's amazing to hear, man. And, you know, I think if anyone's listening to this, if that doesn't at least encourage you to be more proactive about your health, then maybe you can impart the story into someone else who may help in some capacity. What message would you give to someone who's like anxious about going to their GP?
Do you know what? That anxiety, first of all, needs to be acknowledged.
Yeah.
And I think a lot of time, like you said before, you feel like people are telling you things, telling you about yourself. Whereas now everyone is putting themselves in the other person's shoes. We understand the fear because we are also patients, you know, we also need to get checked. And we also are fearful. But we have that knowledge and we're sharing it with our community. And that fear of the unknown, of not knowing, is what's unfortunately killing a lot of people. And there's the saying, feel the fear and do it anyway. feel that fear and go to your GP anyway, even if it's nothing, because the risk of delaying treatment, the risk of finding out when it's maybe too late or quite late or in a later stage is something that can be avoided. So my encouragement is don't be afraid to get checked. Don't be afraid to book that appointment, even if it seems like it's nothing, even if it seems like it's minor or you want to brush it off. I'd rather you come and waste our time and you have more knowledge. I always tell patients when they come, it's like, oh, sorry, it's a waste of time. It's like, no, because now you know. Everything doesn't have to end with a pill. But that's
100%.
what we've grown up with, with the pill that solves everything, the pill that treats cancer, the pill that treats high blood pressure. But it's not like that. The knowledge is what is needed. And if it is something serious, finding it early could save your life.
110%. I agree, man. That fear is so much less than that possible outcome of not exploring it. We hear a lot about like health remedies, physical stuff you should do, exercise, all this kind of stuff. But what can people actually tangibly do to lower their risk of like developing cancer?
Yeah, so I always mention 3 things, and this is valuable not just for cancer, but your general health. Okay, so we hear a lot about your diet choices, exercise, so your lifestyle, and community. Okay, so what can lower the risk of having cancer? Well, the lifestyle that you're living is very, very important. Some people smoke, drink alcohol, and although people are aware, they may not know how bad it is, but it really, really hires and multiplies the risk of developing certain cancers, like cancer in the mouth. People don't even think about that you can have cancer in your mouth, in your throat, in your food pipe, cancer of the breast, the liver, many others. I talk about exercise. Do you keep yourself active? Are you working from home all the time? So during that, do you take breaks and walk about? That itself can increase a better health. And then community. Community is, do you talk about it with your community? Is your community aware of things? Because if you're like your mother-in-law is aware of certain things that, you may not be aware of, she will be the one to point them out at you and then makes you think. So the power of community is very, very, very strong. And of course, genetics. We know that some cancers are due to the genetics. If somebody in your family had certain cancers, doesn't mean that you will have them, but you're at higher risk. So you can prevent certain things from happening. You have that knowledge. You know what to look out for. You'll be quicker in accessing the primary healthcare to get yourself checked. Like yourself, you got your prostate checked because now, you're becoming of age, you have children. So that prostate cancer is higher in black men. So you did the right thing. So that's how we can prevent and reduce the risk of later stages of cancers.
It's really important that, we kind of put our health at the forefront of our lives sometimes, because sometimes we're so busy with everything else, whether it be work, child rearing, showing up for family, etc., etc. But at the end of the day, none of this matters if we don't take care of our most valuable asset, which is our health. We can't be there for anybody if you're not here, So we need to take care of ourselves so we can ultimately take care of each other. Guys, if you're listening, if something doesn't feel right, contact your GP practice. Until you find out, you can't rule it out. And for more information on cancer signs, symptoms, check out nhs.uk/cancer symptoms.